Good morning, everyone. Welcome to the March 2012 Broadband Breakfast Club, maximizing U.S. health IT and broadband investments. I'd like to thank the sponsors of the Broadband Breakfast Club: Comcast, U.S. Telecom, the National Cable and Telecommunications Association, ICF International, Google, the Telecommunications Industry Association. Please give a hand to the sponsors of the Broadband Breakfast Club.
The FCC is very interested in helping rural healthcare providers use broadband connections as a means of providing quality healthcare to patients in rural areas and to help them take advantage of developments in telemedicine and health IT more generally. As the National Broadband Plan noted, broadband is not a panacea. However, broadband-enabled health IT solutions offer the potential to improve healthcare outcomes while simultaneously controlling costs and extending the reach of the limited pool of healthcare professionals. Furthermore, as a major area of innovation and entrepreneurial activity, the health IT industry can serve as an engine for job creation and global competitiveness.
We, as a nation, both on the public side and on the private side, are spending a tremendous amount of money in the area of broadband and health IT and trying to make all kinds of magic happen by bringing these technologies together. I mean, just as an example, I mean, we allocated some $20 billion to facilitating healthcare, electronic records, processes, a number of initiatives for increasing broadband adoption by physicians and so forth. At the state and local level.
The California Telehealth Network, as has been described, is California's statewide broadband network dedicated to healthcare. Our mission is really to use broadband technology to expand the reach of healthcare, quality healthcare, into communities with an emphasis on rural and medically underserved communities. Medically underserved, of course, we refer to generally the urban areas where there's population density, but not much in the way of healthcare providers.
The role that the USDA Rural Development Mission Area has in the area of health IT solutions, both from the equipment standpoint and the infrastructure standpoint. Specifically, the Rural Utility Service has had a very deep commitment, as many of you know, in financing high-speed broadband networks in rural high-cost communities. We've been doing it for 60 years. We have a program, as many of you know, the Distance Learning Telemedicine Grant Program that started in 1992, that is a very successful program that we're very proud of, that has made tremendous impacts in supporting health IT equipment and solutions in rural high-cost markets to essentially overcome the distance challenges that so many rural communities and tribal areas face in getting advanced medical care at the local level.
And I am with the Delaware Health Information Network, or the DIN, and we are what's called a health information exchange. And so what we do is that we receive information, electronic medical results, from the labs, Quest and LabCorp, and a small local lab here in Delaware, as well as the major hospitals of the state. And all that information each comes from their proprietary systems. So everyone stores and transmits information differently. So what we do is we take all that information and we store it, and then we standardize it. We then send that information to then the different providers of the states.
Georgetown is part of the MedStar Health System. Those of you from the area may be familiar with that name. We're a 9-hospital system, and we stretch from the northern Baltimore counties down to St. Mary's County. So we actually run the gamut of the urban facilities all the way down to the rural in St. Mary's. I was really pleased to be asked to be on this committee because we are actually herding cats. MedStar has about 27,000 employees, so to implement the electronic health record means bringing up to speed 27,000 people from, say, 18 years old to about 74 years old. So you run the gamut of the knowledge and the literacy of computers and what broadband is and what technology has to offer.
I think in the last few years, the real change that's come about in terms of telemedicine and broadband has been a combination of things that are in front of the camera and behind the camera. And I think we've had some good examples as we go down. I like to point to radiology as one of the success stories, because radiology is a quiet, behind-the-scenes activity that's transformed most hospitals. Most hospitals use teleradiology in some way. As a radiologist at 3 in the morning, they see the image at home, or they outsource some portion of their services after hours, or now about 10% of the contracts of major radiology firms are actually doing primary reads, and some hospitals are actually outsourcing everything to a group of radiologists who are not in the hospital. And patients don't see that, and it doesn't matter whether they see that or not, because you usually don't see your radiologist. The largest firm, Virtual Radiologic, did about 7 million reads last year. And so it's really transforming the way healthcare is done, but it's not what people point out saying, boy, this is telehealth, this is something, isn't this great? It's a behind-the-scenes thing. And the really transformative nature in healthcare for telemedicine is when it's not called telemedicine, when it's just a practice of care and everyone accepts it because this is just the way we do it.